Hi, it's Julian from the Spinal Health Centre. I'm here with Activator Extraordinaire Adjuster Brad. We're going to run through a basic scan, and then I'm going to run through the stuff that I'll be teaching over the next couple of weeks up at the Scottish Chiropractic College in Edinburgh. We're going to cover the additional thoracics, sternal tests, some additional cervical tests, the jaw, the TMJ, and I'll run through some knee and the ankle foot ones, and I'll probably run through the ones that I tend to do and check most of the time. I run through the basic scan first. I adjusted Brad on Monday, so not too bad. He's had a bit of a lower back issue, but how's that been doing?
Yeah, not too bad.
Not too bad. Okay, right, let's crack on. For those of you that are missing out on Steve, he's actually busy helping some of our clients. So we messed up on the diary, and he's actually doing the real work. So we're just mucking about. Okay. So I'm going to go through the basic scan at speed here. 6-point landing. Brad is typically a right PD and is reasonably clearly a couple of mil short, nothing massive. Start as ever with medial tibia. Brad plays a lot of football, so it probably is worth checking knees and ankles most times. Just checking AS, and I know with Brad it tends to be, if there's anything that shows up a lot pelvis, it's usually PI ilium on the PD side. So we jump to a setting 4, and we jump through this. So spine of ischium, sacrotuberous ligament, and into the iliac fossa. Make sure you get the ramp and hold there, so there's a definite pause, and we are now level. Squeeze your knees together and let go. Just checking the pubic symphysis. Right hand up behind your back. L5. Yeah, I said he got a bit of an L5 lower back issue. Yeah, that's coming up quite clearly as a severe. If you want to go beyond the 90s, coming up there, superior. Swap your hands around. I'll just check a bit further up. Both hands up behind your back. Both back down by sides. Take your right hand up by your face. T12. Big deep breath in and out. T12 rib. All good. Left hand up as well. Not really. Both back down by side. That being T8. So let's go with the superior T and L5. Top of iliac crest, come across, find L4, find the gap. Tender at all in there? Little bit, often is on the superior inferiors. There we go. So turn your head to the right. T6, lift the right shoulder off the couch, back down. Shrug both shoulders up to your ears, back down. Squeeze right elbow into your side, let go. Squeeze the left elbow, let go. Shrug your shoulders up and roll them back. And you definitely should be going through it roughly this speed. Maybe a first rib there. Head back into the center. Just lift up your head, down. Tuck chin down to your chest, back to center. Push your face into the couch and let go. Possible C5 there. Stretch your right hand to right knee and back round. Left hand to left knee and back round. On the advice of Arlen. The essential scan, difference between the basic scan and the essential scan is check the QLs we're checking on every time. So, right through about there. So, right PI and the superior L5. The kind of finding you'd expect if somebody had only been adjusted 2 days ago. Yeah. So we'll run through the additional thoracics. So take your left hand up above your head. T11 isolation test. Big deep breath in and out. Like 12, worth doing the ribs separately. That's okay. Arm back down by side is T9. Take right hand up above your head. That's your standard T12. Arm back down by side. T 10. Both hands up by your face. Standard T8. Bring your arms down by your sides and pinch both shoulder blades up behind your back and back down. T7, all looks good. Turn your head to the right. We know that as T6. Left hand up above your head. T5. Swap your hands around. T3. Arm back down by side. T2, and possibly one that's in the advanced notes, not in the textbook notes, both hands up above your head, is also a T2. I find that one personally more accurate. Arms down by your sides. An additional enhancement for C7, shrug both shoulders up to your ears, head back into the center, drop your shoulders. We'll show up any C7s that are suspected, not found. We'll go through the extra cervicals now. So shrug both shoulders up to your ears, back down. C6. Turn your head to the right, look up top right corner. Is C4. Look down at your right shoulder. C3. Possibly a C3 there. Yeah, we'll go with that. Head back into the center. So C3 on the left. Setting 2 will do. Slight tuck of chin down to your chest. Come off the occiput. Find your C2. Find the gap. Come across. Find the transverse process. Line of drive. Anterior superior. Slightly medial. Give it one of those. Head back into the center. I'll just go back and check that. So I'll run through the sequence. So turn your head to the right. Look up top right corner. Look down at your right shoulder. That's the C3. Yeah, that's cleared. Head back into the center is another C2 test. Now, if you've really got someone with neck issues, the enhancement test for those is to do the same on the other side. So you do, let's just do it, Brad. So turn your head to the left, look up top left. Look down at your left shoulder. Head back into the center. Should come up clear, and did. I just want to go back. So there's variations on C5. Lift up your head and look at the wall in front of you. Tends to be a better C5 test if you suspect. And I think also a non-textbook one here for the posterior C5. Lift up your head and look forward. Push your chin forward. Again, we're not getting anything there, but that would be a posterior C5. You've gone to the spinous process and adjust straight posterior to anterior, P2A. Okay, sternal test, probably the one that I find more than anything which is in the textbook, is the superior sternum. So it's lift up your head and hold. Big deep breath in and hold. And then you're checking in position 1, checking in position 2. Look, there we go. There's a superior sternum. Oh, excellent. So we'll adjust that in a minute. Going to run through jaw. We've got 6 tests, although one of them is both sides, so you could say 7. Bite your teeth together nice and hard, and let go. Superior TMJ. Open mouth nice and wide. Anterior extension of the jaw, and let go. Push open mouth slightly. Push your lower jaw to the right. It's for right lateral. You don't necessarily need to go to position 2. Go to the left because it's a unilateral. Position 2 is more sensitive, so especially with these jaw ones. And let go. Anterior jaw, straight anterior. Push your bottom teeth over your top teeth. I always find if you say it like that, people know exactly what you mean. And then they just do it. That's good. And relax. Push the tip of your tongue to the back of the roof of your mouth. And I don't know if it's coming across clear on the video there, but all of those movements, and you can relax, Brad, I can see the back of Brad's head is moving. Often with people, when you do you say move your jaw to the right, they'll go, yeah, I'm doing it. I say to them, I can see the back of your head's moving, you don't need to tell me. It's really obvious. And some people, it really does move. Okay, so we've got our superior sternum to adjust, and Brad, nobody forget, including Brad. Let's go down to ankle and knees. I'll run through the ankle test. So, you might want to just come down here, Cameron, just so you get a bit closer. Definitely a good one to check with Brad, especially somebody as I say, plays a lot of football. So superior calcaneus. We've got, if we are rotating the foot in there, that's for a medial talus. Going the opposite way is for the arch. You've got a posterior distal fibula, anterior distal fibula, inferior distal fibula. There you go. That shortens him up. Let's adjust that one. There we go. One I tend to find a lot is a anterior distal tibia. So I'm just stress testing that way. That's good. AS navicular is a tissue pull there. Squeezing the toes is for an inferior metatarsal. And then we've got the kind of the rarer stuff. It's probably worth, so medial calcaneus. That one does tend to, I probably undercheck that, to be honest, and it's worth checking. Push against me, which is for gastroc. Push your toes up towards your head, which is an anterior, straight anterior navicular. Sorry, anterior talus. We were talking about this earlier on because it's probably tibialis anterior is involved. But okay, so moving up to knee, anterior tibia, posterior tibia, internal rotation, external rotation. There is a valgus and varus ones, which I call a shear. No, all good. In the textbook, we've got a medial compression. There's a lateral compression. LCL, MCL. And there is a just straight compression. Don't tend to see that too many of those. And then patella. So I'm just sweeping inferiorly on the patella. You can go lateral. They can go medial. And I don't think in the textbook they can also go superior. I've got a superior patella on my left leg. Okay, so I'll run through the left leg. I'm going to do that at kind of clinical speed. So here we go. Okay, you're keeping up there. Push against me. Push against me. Squeeze the toes. Ones I forgot to mention earlier on, there is an inferior medial navicular. That can come up, probably not. And the fifth metatarsal cuneiform, you can compress that one. If you just come around, I'll do it on this side for you, camera. So if you come around there and actually just compress that. When that one's active, they will scream because it will be super, super tender. Okay, moving up onto the knee. Anterior, posterior, internal rotation. We'll have that one. Okay, so into the tibial plateau, and we're adjusting to basically get the torsion. Effectively, it's a lateral, but I'm kind of mentally thinking of it going round the curve there. Fibula head. Didn't chuck in a lateral fibula head earlier on, did we? There's the medial and lateral compression. As I don't tend to find too many of those. Shear, shear. And from there on in, and don't think you're ever going to remember all of these because they do definitely come and go. That's why we have to go back to the textbook. If you really want to learn it, try filming it or teaching it. Yes. Other things that I can hear Brad thinking, because he tends to remember these better than me. Quads and hamstrings, especially with a footballer. So pull your heel up towards your head, and let go. And left, let go. Not really. Quads, push against, let go. Tempted by that one. So I have a right quad. And push against. There you go. Was it training last night? No. No. Lack of training. Okay, so I'm going to turn Brad over. We've got a right quad to adjust, and hopefully nobody forgot about the superior manubrium. Okay, so we're back and we're adjusting a superior manubrium, the top of the sternum, and it was a right quad, wasn't it? Yeah, right quad. So I would go turn your head to the left, just as I'm turning on the side. You could probably go setting 2 or 3 onto the top of the sternum, and we're trying to go as inferior. I would say, but it can be a bit sore. Yeah. Typically, if you're going to adjust sternum, there are additional sternal tests, just an inferior and superior stress test, and the same also for the xiphoid process, superior and inferior. And then you can do a prone leg check. So you could do inferior sternum and check it. Superior sternum. If it's there, it'll be obvious, and they should be very level at this point, and you're looking for obvious clear change. With women, if you're adjusting sternum, one, be careful, be sensitive to them, but also it's worth saying, I would say men, probably 10% or less will be sore after it. Women, it's probably about 50-50. They can be a couple of days properly sore in their chest, like it's been bruised. So just, if you tell them and you're wrong, they won't mind. If you tell them and you're right, they'll be glad you did. So, right quad. We're looking for the vastus medialis origin, the trigger point in there. Oh, there he is. Yeah, right there. Yeah, go on let's go setting 3. It's a lot of quad in Brad, so yeah. Good. Excellent. So that will be most of what I covered during my 2 trips up to Edinburgh into Scotland. And for you students, I hope that was useful. Hope you appreciated that. You might have to watch that a couple of times. We were watching these videos, you go over and over and over again. But it just gives you some idea of what you actually would expect to do within clinics.